Welcome to today's in-service workshop on Oppositional Defiant Disorder, otherwise known as ODD. Today we're going to discuss what ODD really is and how you can help students that have ODD lessen some of the symptoms that they have in your classroom, how you can feel more comfortable having them in your classroom as a teacher so you know what to expect, and how we can help you and the child both have a successful year. ODD is defined by a continuous pattern of negative, defiant, disobedient, and hostile behavior toward authority figure that persists for at least 6 months and is characterized by the frequent occurrence of at least 4 of the following behaviors: often loses temper, often argues with adults, often actively defies or refuses to comply with adults' requests or rules. Often deliberately annoys people, often blames others for his or her mistakes or misbehavior, is often touchy or easily annoyed by others, is often angry and resentful, is often spiteful or vindictive. There are 3 subtypes of ODD. The first one is actively oppositional. It's the most common one that we see. In this subtype, we habitually hear the word no and lots of arguing. The child will also come up with lots of creative excuses and ends up doing exactly the opposite of what was asked. The passive oppositional subtype is where the individual will ignore responding to the request or delay acknowledging a response to the request at all, and really pretty much be a passive in terms of even acting as if they've heard anything and just kind of ignore any type of acknowledgement at all. In terms of the passive-aggressive subtype, we see both the passive and aggressive behaviors are combined and not alternated. The child can be having a very sarcastic smile on their face while they're carrying out hostilities, and then may apologize with a sweet smile and appear very guilt-free and innocent once the hostilities are ended. In the overall population, the prevalence of ODD is in 3 to 16% of children that can be classified as having ODD. Girls are less likely to be diagnosed with ODD than boys, and if they do have ODD, then girls typically express it differently and are more withdrawn. Prior to age 8 is most often when we see ODD diagnosed, and no later than adolescence. Culturally, we see families from lower socioeconomic statuses having an increased rate of children with oppositional defiant disorder. Etiology. Biological. Parents report from an early age that the child was less flexible, demanding, more active than other children. Environmental factors. There may be a higher rate of dysfunction reported within the family with children that have oppositional defiant disorder. Discipline styles may not be consistent in families, and there may be less supervision. Behavioral. Children with ODD are going to be more confrontational than their peers. They will not transition well or adapt to new situations. They can be very resistant and defiant in their behavior. Social and emotionally, they're more apt to avoid social situations and interact with others. They will often have poor relationships with teachers and others in authority positions because they refuse to do what is asked of them. And they also may not have empathy. Cognitively, there are definitely deficits in problem solving, working memory, and self-regulation of responses for children with ODD. Academically, they are lower in confidence with their academic ability, and they often struggle with compliance, which also affects their academic ability. Long-term outcomes for children with ODD, they are definitely at a greater risk for poor academic outcomes, like failing out of school, poor relationships with their peers, and are more likely to experience increased risk for mental disorders as an adult, such as depression and mood disorders. They're also more likely to have problems with substance abuse. ODD is typically seen with other conditions such as depression, anxiety, conduct disorder, learning disability, ADHD, or other mood disorders like both bipolar disorders. So with these co-occurring conditions, it can be hard to single out what is ODD and what is one of these other conditions because it overlaps with other disorders. It's important to realize that families that have children with ODD are experiencing lots of stress within their households. And so remember that as you come into contact with children and families this year as you deal with situations. Remember, it's always important to be in contact often with families to let them know what is happening at school. One thing you really need to remember is that families often feel very isolated and are sometimes more dysfunctional than other families that don't have children with ODD. Parents have really, at some point, long stopped enjoying their children and really feel a sense of guilt about the fact that their children have ODD. And they feel that it's their fault, that maybe it's some kind of maybe they weren't good enough as a parent instead of the fact that it's a disability. Attending family therapy can help families learn to accept and better understand ODD and learn ways to handle behaviors. One example is tagging. For example, I'd like to discuss this later at a time when both of us can be calm. You end the discussion there, and then a teacher or a parent is not trapped by the outburst that the child's having. What's really important for kids with ODD is that they attain social skills training and that they do that on a regular basis with their peers. Going to social skills training gives them the opportunity to learn how to interact with their peers and authority figures. They work on also learning to control emotional responses and other various social skills like taking turns, sharing, and manners. Establishing an environment of trust in the classroom where each student feels part of the class and is valued is very important, especially for the ODD child. Use positive supports to help the student overcome difficulties. Use alpha commands and establish the fact that you are the alpha in the classroom. Use eye contact with the student to help increase compliance. Maintain predictability in the classroom routine to decrease anxieties. The more anxieties that are created for the ODD child, the more ODD behavior you're going to see. It's also important to create a physical environment that helps keep noise to a minimum and desks out of high traffic areas. You'll see that students do better in quiet environments without having tons of movement going on around them, and we'll see that here in just a moment with our next slide. Establishing an environment for learning in the classroom is very important. There are studies that have been conducted that show that there are several things that need to be done to create a better learning environment and that students actually learn more by creating these types of environments. One is making sure that they are definitely seated in an area that is in the center of instruction out of high traffic areas. And in the first picture that we see in the far top right or left-hand corner, we see that this teacher has done a very nice job of that. There's a place for their personal belongings, which is inside their desk. Communal belongings have a basket that they can be placed in on top of their desks. There are also minimal distractions around the room, and the focus is really right there on the whiteboard where the teacher is either writing or projecting her lesson. The next picture at the top, I just really liked this because we've talked about making sure that students are valued. And this one, right away, this teacher has done a nice job making sure that as their students enter the classroom, that they feel valued and they understand that they're important, they're loved, they're respected, they're a friend, and they're the reason that they're here right off the bat. No questions asked. And I liked how that teacher had done that. Another thing that's really important for students that have ODD or even autism, any of those social skills deficit disorders, and they get ramped up and can become overly emotional, it's nice to have a quiet area where they can go to calm down. It could be a quiet area like this one that's been established in this room, or it could just be a beanbag somewhere off in another area where there may not be other students in the classroom. But this teacher's done a nice area with a reading nook, providing several different chairs, pillows, beanbag chairs, and rugs that students can lay down and read. This would be a great corner for a student who's getting ramped up or has already gotten ramped up to go off and cool down, and then be able to either come back down after getting really ramped up, be able to talk to the teacher about what happened, or rejoin the previous work that the student was doing before getting upset. In the last picture, we see that this teacher has done a nice job labeling different activities on the shelf. Not only is it easy for the teacher to find an activity, but during downtime, students can come over and they can find activities to do and work on. There additionally have been studies that show that if there are activities in the room for children to come and find, that there are less behavior issues going on in the classroom. And this is a great example of how children can find an activity to work on. Provide choice-making opportunities whenever possible. This is through opportunities like we just saw on the previous slide, or in your lesson plans. You can also provide them opportunities to make choices whenever you can. Also, acknowledge positive behaviors and instill confidence in their ability to succeed. This is important with every student that walks in your door, but it's especially important when you have a child with ODD that has very low self-esteem, any kind of disorder that would be consistent with, or any student with, but you need to work on helping students with ODD especially build upon that. You also need to collaborate with other teachers in the building, especially the special education teacher. That special education teacher is really going to become your ally and one of your greatest resources this year. Use her suggestions and her knowledge of ODD to help you. That teacher will be able to provide you information that you don't already know, and lots of suggestions that might help you in your classroom, help prevent the ODD student from getting overwhelmed and being even more successful. So use those suggestions and try implementing them and be open to them. Using behavior charts or establishing contracts with students about behavior expectations are a great way to visually use supports to show students that they are doing what's expected of them. They can visually see that they're earning stickers or other things like pennies or chips or different things like that, so that they know that they are doing exactly what's expected. There's additionally been research done that therapy dogs benefit children by creating relationships. They receive unconditional love and they have a calming effect on students. And this is especially true for students that suffer from ODD. They definitely gain significant positive effects from having therapy dogs in the classroom. And obviously it's not possible to have necessarily a dog in your classroom at all times, but you can look into having a therapy dog come and maybe visit on a semi-regular basis, or see if there are also programs in your community where kids can read to pets. So that may be another opportunity as well that you can help a parent get their child involved with. Some of the things that you've learned here today will help you have a successful year. And remember, that successful year begins with you. It's now up to you to take the information you've learned today and apply it to your classroom so that any incoming students you have, those with oppositional defiant disorder and those with other disabilities, can benefit from them. We want you to have a great year. We want the children in your classroom to have a great year. Remember, it begins with you. These are some additional references that you may want to explore that give you some additional information about what I was talking about today in my presentation. If you would like to explore these, I have them on file, and if you have any questions, please don't hesitate to come and ask me. Thank you.